Union Health Minister is taking stock of how the dry run preparations are looking like. Those visuals on our screens. Union Health Minister Dr. Vardhan in Chennai, in Tamil Nadu, taking stock of how the dry run preparations are looking like. As we've been pointing out, very crucial day today, because the dry run will be very important for us to understand, familiarize ourselves with what the processes will look like, so that when the actual vaccine rollout happens, it's all very seamless. And the Health Minister himself on the ground there, taking stock of the situation, the preparations, talking to the staff, understanding what are the kind of challenges they're facing, so that all of them can be ironed out much before the actual vaccine rollout does happen. Remember, the government is very optimistic about how soon the vaccine rollout can happen. You already have two vaccine candidates, Covishield as well as Covaxin, who've now got a nod by the drug regulator. So, of course, these preparations now, as far as the dry run is concerned, are very important. The Union Health Minister there in Chennai, in Tamil Nadu, taking stock of the preparation, helping the staff understand the importance of this dry run, helping them familiarize with the COVID software, as well as also understand what are the kind of challenges each hospital, each state is seeing. That's why the coordination between the state governments as well as the central government is also going to be very important. And that's why today you will have all the state health ministers also overseeing this dry run in their respective states, and then coming back to the center with a list of hurdles and challenges that they saw during this dry run. As we've been pointing out, this is a crucial day because this is the largest dry run as far as the vaccination process is concerned that India is undertaking. Till now, we've had two sets of dry runs. They've all happened in smaller pockets in lesser number of states. Today, we're seeing the maximum numbers of states participate in this dry run much before the vaccine rollout. Now, as per the Health Ministry and the government, the vaccine rollout is now a matter of days. We can see the rollout happen maybe by the 14th or the 15th of January. So before that, this dry run becomes very important. The COVID software, which is where all the data will be punched in, stored, becomes very important, not just for the medical staff, but for people like you and me as well, because this is where we can see the efficacy, if there are any side effects that have been notified. Also, to try and understand where the vaccination hubs will be for the government. This will give them a data of who all have been vaccinated and how many people are left. Remember, as far as our first priority group, we have healthcare and frontline workers. There are 30 crore people as part of that first list. You will have that divided into first 3 crore people who will be vaccinated free. They will be the frontline and healthcare workers, and after that, the rest 27 crore also will be vaccinated. Of course, so we're hoping that all of these dry run preparations, the mock drill can happen seamlessly, so that when the rollout happens, all these differences can be ironed out. Let me go across to my colleague Sneha Mordani, who tracks the Health Ministry for us. Sneha, there we're putting out visuals for our viewers of the Health Minister in Chennai physically on the ground, taking stock of the situation, talking to the healthcare workers to try and understand what are the kind of challenges they're seeing, so that the center can assist them and roll out all these differences before the rollout happens.
Yes, absolutely. And the very fact that the Health Minister during the dry runs has stepped out and has gone to Chennai speaks volumes of the fact, the kind of importance the government is attaching to this exercise, which is in every which way very similar, and is going to mimic what's going to happen when this actual rollout of the vaccine happens. He's got a day-long itinerary in Chennai. The visit to the session site, Rajiv Gandhi Government General Hospital, which is a dry run COVID-19 vaccination camp. Second site at Government Medical College Hospital in the city again. This is the vaccination special camp 2 for dry runs. Then again, he's going to be at the hospital for the non-corona, to look at non-corona activities. The itinerary says, followed by a PPT presentation on COVID prevention and control by Tamil Nadu. A visit to Periyamedu for General Medical Store Depot via Naval Road entrance via Ponamele High Road is what this itinerary says. 2 o'clock or so, he's expected to wrap up. The last stop is going to be a visit to this integrated vaccine complex, Chengalpet. So the Health Minister has a day-long event at Chennai, where he's going to take stock of the situation and assess what really is going wrong. Various state ministers have highlighted issues concerning their respective areas, what they feel were the problems that cropped up in the previous dry runs there. Both the dry run on the 28th, 29th, and again the big one on the 2nd that involved major cities. And this, of course, is the biggest ever. So this is going to be the program of the Health Minister. And like I said, preparations have been made already to ensure that the vaccine rollout starts as soon as possible. The date, of course, is just yet to be announced.
Right. And you know, Sneha, the other important aspect of this dry run and the fact that the health minister there is on the ground is all to allay any possible concerns as far as the vaccine candidates are concerned. We had that quote coming in from the health minister saying, I want to talk about the misinformation which is there out in the market as far as the vaccine candidates, especially after we saw that nod which was given to Covaxin.
Yes, absolutely. And that's what he spoke about in the meeting yesterday also, that, listen, there are some elements who may try and disrupt this process, spread fake news, and, unnecessary scaremongering is something that is expected. So the state government must ensure that that doesn't happen. He's also spoken about this on various occasions that the vaccine is safe, and we relied on science and nothing else. I think the effort obviously is going to be in that direction as well, to tell them what to do to counter fake news. Remember, there is a guideline, a document ready already, a communication strategy that talks about how this is a problem and that needs to be addressed at every single level. I'm very, very sure that on top of the list, really, if the health minister has one to talk to the state government, this is going to figure really at the top, that, listen, you have to do away with the miscommunication. You have to go to the people and, use whatever you can, social media and all your communication platforms to send out a message that the vaccine is for the people, for the good of the people, essentially. And there is no agenda, so to speak, because there's been a lot of politics also, as you've seen, over this entire issue.
Right. And Sneha, other than the familiarization with the COVID software, the other aspect which India needs to talk about is as far as cold storage is concerned. This is something that we've spoken about and why certain vaccine candidates didn't work for India. So are we going to also look at a sense of ramping up in terms of logistics? And this is why it's important for the health minister to take stock of what are the kind of current, specifications of storage that we have and how much we need to ramp up?
Yes, absolutely. But, there have been concerns in the past as far as the vaccine manufacturing companies are concerned that why is there no purchase agreement with the government? Because there's a limit to how many vaccine manufacturing companies can manufacture. There's no purchase agreement. But I think all of those details are being sorted out. In fact, Adar Poonawala in an interview to us had said that orally the commitment is of 10 million doses. And we also broke the story, remember, in the morning with of the government intending to procure 66 crore doses by the month of June. And this obviously is going to be from the front-runner vaccines. The vaccines that have got the approval right now, of course, we'll expect that there would be more to come by the month of June. But just yet we have Covaxin and Covishield, and 66 crore doses is going to be procured from these two companies. So I think the government is also working out a purchase agreement is what we've been given to understand, though I would say that the government has not spoken about it on any occasion. Not one single occasion has the government spoken about how much it wants to really procure, at least not on the record.
Right, Sneha, that's exactly what I was getting